Dr. Downing, thank you so much for this opportunity.
No, my pleasure. My pleasure.
Why step away now?
You know, this is something that we started over 4 years ago. It was really a planned transition, and we wanted to prepare the institution and, you know, get everybody ready for a smooth transition to the next CEO. I've been here 40 years. You know, I've been in the position 12 years, and, you know, quite honestly, I thought 10 years is about what I would do, but COVID disrupted that. And so then, you know, it's, well, okay, we've got to carry on a few more things. I'll stay a few more years. But, you know, part of it is I just turned 71. Part of it is we're at the end of a strategic plan. And so it's time for the next strategic plan. So I can position the organization to get ready to develop that plan. But we need a new CEO to come in, develop the plan, and take the institution forward. So timing was really perfect for me to, you know, sort of transition into the next role.
What do you regard as your enduring contributions?
Yeah, you know, I reflect back, and there are so many things that have happened over the, you know, 40 years that I've been here, and I've been lucky to play a small role in a lot of that. You know, my own research, I think, has made contributions. The Pediatric Cancer Genome Project made lots of contributions. From that came our clinical diagnostics and our cancer predisposition program and the St. Jude Cloud. You know, I think those are all important. You know, I think, you know, some of the most important things, though, are the people that I've been able to recruit into this institution. I think we have brought in some of the most brilliant minds in the world to be leaders here at St. Jude. We are almost in a virtuous cycle of recruiting the best people in the world into St. Jude. And so I've been lucky to play a part in that and to, with them, develop this vision for the future and execute on that vision. And so, you know, from, you know, fundamental science and making progress in structural biology and imaging science and data science to St. Jude Global, and, you know, changing St. Jude from a small place in Memphis to a global institution that now is tackling cancer at a global level. So I think, you know, it's that transformation of St. Jude into that global institution and to the contribution it can make. But it's not me, it's the people that we brought in here to St. Jude.
I knew your humility would kick in, and it certainly has. I know that COVID was certainly a chapter that'll be in your book.
Yeah.
And you navigated the institution through that very tricky, treacherous moment in our own health as a world and nation, and especially in these vulnerable young people. What resonates from your time? I know you set up protocols immediately for testing for everyone, and then kept everyone away who shouldn't be anywhere near the place, right?
Yeah, I think, you know, what resonates, or what I reflect on most, was the way we instantaneously came together as a community. I mean, literally the Friday before we were going to shut the place down, we were in a conference room, the leaders were there, and we just gelled and immediately, all right, we're going to set up a command center, you're going to take over this, you're going to take over this. We had everyone on the phone that needed to be on the phone. Here's the way we're going to do this. Let's figure out how we're going to set up diagnostics. Let's not wait for the pharmaceutical and biotech companies to figure this out. We are experts, we can do this. You know, and nobody was afraid to put in the time into work. And, you know, there was a group of us here every single day, right? Because we knew the patients are going to be here and the nurses were going to be here. And so all of us came in. And, you know, we didn't wait for anybody to tell us how to respond. We decided we knew what we needed to do to protect our patients, and we were going to speak up and do that and reach out and talk to the community about that. You know, so I think, you know, our employee sort of scores actually went up every year during COVID. They loved being part of here. They trusted us. They wanted to help and do this. And that's what amazed me, because it was, all of us were worried, you know, when it started, I wonder if I'm going to die from this, right? And yet, well, but I'm coming into work, you know, if I die, I die. That's just the way it is, right? We've got to do what we got to do. And I would say everyone had that attitude. They were afraid, but they were committed to this place, and that was unbelievable to see. And so, we carried some of those practices forward as we went out of COVID also, and it helps the institution in the way it functions today.
The environment is secure and sterile and as protected as it can be.
Yeah, no, absolutely. Yeah.
So when you reflect especially on your work on the Genome Project, which was a gigantic moment in science, and you've been noted for it, us laymen honestly don't understand much about that foreign language. Mm-hmm. But if you could share with us what resonates with you about, that contribution.
Yeah, I think, one is the bringing into the institution data science in a way it had not been brought in before. So we're talking, Pediatric Cancer Genome Project was 2010, but even before that, with the sort of advent of single nucleotide polymorphism arrays and our genomic efforts to look at leukemia, we started bringing in data science. We were bringing in machine learning languages back in 2002 actually, and in a big way in 2010. That gave us a leg up in the application of that data science forever, right? And so now we have a big data science initiative. We have 1,000 data scientists on the campus. We, have a data center, and we're expanding that. We have an AI hub. We had a day of data-intensive symposium. We have, computational biology. So the lasting legacy is that we've gained insights into pediatric cancer through the mutations we identified. We incorporate that into our diagnostics. It helps us risk stratify. It helps us treat kids. We incorporate it into germline analysis. We have a cancer predisposition clinic. But even over and above that, it brought in a whole new way of thinking, this data science. And with the explosion of AI now, we're just unbelievably well poised to be able to apply that and accelerate progress against pediatric catastrophic diseases. So.
When we look right across the way here at the graduate school in the Marlowe Thomas Center that you pioneered and fought for as an investment that the institution ought to make in order to, quote, grow your own experts, and you have done that, and that is an extraordinary accomplishment.
Yeah, no, we were at dinner last night. We were having our values celebration. 40 individuals from St. Jude are recognized for representing the St. Jude values, and they get recognized in front of the whole institution, and then we take them out for a private dinner. So we were at the Capitol Grill last night with those individuals, and I got lucky and sat next to the woman who's in charge of student life for our graduate school. And so she's only been at St. Jude a year, and so we talked a bit about the founding of the graduate school and our idea of bringing in the best students, giving them a unique training, in a way that they couldn't get anywhere else. And she was just reflecting on how unbelievable the students are, and that we have succeeded in getting them from, the best schools in the country, and we're on our route to get full accreditation. We've expanded. We thought it was just going to be a PhD program. Now it's a master's in global medicine. It's a master's in data science. It's a master's in clinical investigation. And so very diverse student body, but all part of this community. And the great thing about graduate students is, they're almost insatiable in their appetite to learn, right? And they are naive, so they're not afraid. They I want to learn about that. I want to work on that. Somebody who's a little bit more sophisticated, well, yep, that's too risky, so I'm not going to work on it. But they're not. They will jump in and take that. And so they add an element to our culture that no one else can add. And so that's why they're so critical to us. It's not only us training them and hoping some work here, it's just their simple presence makes us better. And so that's what's great. And so to see these students come in, to see them apply, to see them grow, and to see where they go. We have one now that's graduated from the PhD program, and she works in policy in DC for us, right? And so to have her understanding, but to be able to talk to people in Congress is a good thing. So yeah, it's been great, and we'll see how it grows, I think, over the future. So
how many students are there?
I forget exactly. It's, there are almost 20 per year that are in the PhD program,
Okay.
and often that's 5 years. There are 10 per year in the global, program, and that's a 2-year program. There's probably about 10 in the other ones, and each of those are 2-year programs. So somewhere, near 100 students, well, over that, probably 150 students at any time are part of the overall program. And the global program, they come from around the world. So it's really impressive to see them. It's the other thing I'll just comment at the dinner last night. We have, and I'm very proud of this, we have one of the most diverse workforces in the world. There were people from all kinds of different countries at the dinner last night. Somebody from Pakistan, somebody, from Palestine, somebody from Gaza, somebody from, India, Lebanon. It was just, from all over the world, people coming and working at St. Jude, and that helps us, right? That, gives us perspectives of scientific perspectives, medical perspectives that we wouldn't get otherwise. So.
And the St. Jude Global, which you mentioned in your accomplishment list, which is vast, but that one is notable because it is global, and it is a sincere effort that's within the realm of our lifetimes. So we're both in our 70s now, and we want to live to see progress. And you and your team pioneered this idea that let's, by 2030, try to reduce the incidence of childhood pediatric cancer
deaths
to to 60%, right?
Yeah, well, the cure rate's to 60%. So, it's an interesting story, because we were sitting in a restaurant in Geneva, with, the leader of non-communicable diseases from the WHO, and myself and Carlos and a few other people from the global program, and we had become a collaborating center for childhood cancer with the WHO. But we were there talking about this new initiative, the Global Initiative for Childhood Cancer. And, it's sort of, well, what is our goal? And so our first goal was, we're touching about 3% of the kids in the world with our efforts at St. Jude, and we want to touch 30% by 2030. And so, nobody else is paying attention to them. How do we make that log leap, to get to 30%? The second was, well, for ALL, could we advance cures to 60% from where they are in many countries, 20% by 2030? And then as we sat there, it's like, well, why limit it to ALL? What about, and so then we come up with a list of the most curable pediatric cancers. Well, what about all of them going to 60%? So we knew it was a stretch goal. We knew it would be very hard, but that's what we're shooting for. And, we knew reaching 30% of the patients would be hard, but we've reached it already, and it's only 2026. And so we are touching 30% of the kids across the world right now through the St. Jude Global Alliance. They are part of our community now, and they're, benefiting from what we do on this campus and from the resources, the intellectual and tools and recommendations that we give them. Some of the pediatric cancers are, getting advanced to that 60% cure rate within particular countries, but ultimately, what that goal helped us do was to crystallize what's going to be needed to accomplish that. And so it's not just, first they didn't have access to, drugs in a reliable manner. Well, we had to create the global platform for the access to childhood cancer medicines. Half the patients don't get diagnosed. Well, what about global diagnostics? How might we do that? They don't have access to radiation therapy. Well, how might we do that? So we're now partnering with the International Atomic Energy Agency to figure out how to train and how to get those facilities into those countries. Surgery. How do we train surgeons to be able to do the kinds of surgery that's needed for those cures? So, it's a stretch goal, but it allows us to say it's possible, what's needed, and how do we get that accomplished? So, I think the impact is going to be immense. As we move through this program and actually push for those cure rates. We're also going to learn so much from those countries that will reflect back on how we treat children in this country. And so I think, it's a two-way street in interacting with every one of those countries.
Well, I have a million questions for you, but I know you only have a limited amount of time, so let me ask you this. Your next phase, so the next chapter for you is what?
I'm going to fade into the background. I've been a leader long enough, and somebody once said, I have no need for any recognition, but I still have a lot to give. And so, I'm going to keep working at St. Jude. I'll go as a faculty member. I'm a faculty now. I'll continue as a faculty in the Department of Pathology. I'll move to the Department of Global Pediatric Medicine, and I will help in any way I can in that department. I'm going to help in leadership development at the institution. We have a leadership academy, and so I have 30 years of leadership experience. I can help in training that next generation, whether they're faculty or whether they're part of the administrative staff. And then I'm going to help ALSEC raise money. I can talk about this institution and tell them why they should give money here and why we are a national and international resource that will change the way medicine is practiced. And I firmly believe the world's a better place because we exist. And so people want to be part of that, I think.
Well, I know the founder, Danny Thomas, is so proud of your accomplishments and would be stunned to see the incredible developments that have taken place, both physically, scientifically, and intellectually, in recruitment, in patient development and cures, treatments. I mean, it's a remarkable story. So congratulations.
Well, thanks. It's been a privilege to be here and to just be part of this workforce. As I said, it's the greatest workforce in the world, and I'm just proud to be one of the workers. So.